Firstly, in the event of an electric shock or an emergency, do not panic. Switch off the current immediately. If possible, shut down the electricity supply at the mains board as well. Never touch a child who is in contact with electricity. If you cannot turn off the source of the current, use a plank, a wooden stick, rope or wooden broom to push the electrical wires or appliance away from the child. Make sure your hands and feet are dry and that you are standing on a dry surface. When it is safe, carefully position the child on its back and check for responsiveness. Shake him gently and ask, "Are you okay?" If the child does not respond, open the airway and check for breathing. Watch for the rise and fall of the chest. Listen for sounds of air movement near the mouth. If the child is breathing, place him in the recovery position and call the emergency medical services. If the child is not breathing, start CPR and send someone else to call the emergency medical services. If you are alone, perform CPR for 2 minutes before calling the emergency medical services. To perform CPR, open the airway by lifting up the chin with one hand and at the same time push down on the forehead with the other hand. Pinch the nose closed. Cover the child's mouth tightly with your mouth. Keep the chin lifted and the head tilted. Give 2 slow breaths. Do not give full, forceful breaths. If the chest does not rise, try the chin lift, head tilt again, and give another breath. To perform chest compressions, place the heel of one hand on the breastbone, just below the nipple line. Make sure the heel is not at the very end of the breastbone. Press down on the child's chest so that it compresses about 1/3 of the depth of the chest. Give 30 chest compressions. Each time, let the chest rise completely. These compressions should be fast with no pausing. Count the 30 compressions quickly. Then give the child another 2 slow, full breaths. Continue cycles of 30 chest compressions followed by 2 slow, full breaths. After every 2 minutes, recheck for breathing. If there is still no normal breathing, coughing, or any movement after the first 2 minutes, leave the child to call the emergency medical services. After you've called the emergency medical services, continue to administer CPR.
If the child starts breathing again, place him in the recovery position. Kneel next to the child and remove any glasses and bulky objects. Place the arm closest to you at a right angle to the body with the elbow bent at 90 degrees and the palm upwards. With your one hand, bring the arm furthest from you across the chest and place the back of the hand against the nearest cheek. With the other hand, pull the far leg into a bent position and pull it so that the child gently rolls towards you whilst protecting the head with your other hand. Adjust the leg so the hip and knee are at right angles. This will support the body. Tilt the head up slightly. Make sure the hand is under the cheek to support the head. Monitor the child regularly for breathing. Place a blanket over the child and stay close until help arrives.
Before applying CPR, there are a few things you need to know. If the patient demonstrates normal breathing, stop chest compressions. Unless you are a health professional, never check for a pulse. Only a healthcare professional is properly trained to do this. Remember, in the event of an electric shock, do not panic.